I mentioned earlier about mental health inequalities, and particularly that the fund that we've just recently launched around addressing mental health inequalities in ethnic minorities. And you know, in Leeds, as across the country, people from minoritized ethnic groups are more likely to experience mental health problems and less likely to receive good quality, timely support that meets what they need. And children and young people also from minority ethnic groups are underrepresented in support services for a whole variety of reasons, and I'm sure our next speaker will talk about some of them. But really looking at you know, the focus of that work for the foundation was about trying to build trust and break down barriers which were preventing people accessing support for their mental health. Certainly it's been a you know, a real pleasure to work with Heather Nelson from Black Health Initiative. We've worked with Heather for quite a number of years now, and I'm really delighted that in recent years we're actually starting to make some progress on some of the agendas we've been tackling for so long. There's still a great deal more to do, but actually what Heather and the team at Black Health Initiative are doing is really working to address inequalities in education, health and social care. And they work with decision makers within the city and ensure that inclusion is positively and intentionally incorporated within planning and decision making. They've certainly been a great support to us at the foundation, and I'm delighted to introduce Heather to share a few of her insights into the work she's been doing recently. Heather Nelson.
Good morning, everybody. First of all, I'd like to thank you, Kate, for inviting me to speak, and also for all the work that you and your team does. It's invaluable across the city and across the region, to be honest. Stevie, this should have put me on first and you followed after me, because you're brilliant. I don't know how I can engage as deeply as you did. It was heartfelt and a good presentation. So as Kate said, my name is Heather Nelson. I am the Chief Exec of Black Health Initiative, known as BHI. Our main office is here in Leeds, but we do work across the Leeds City region, wherever our work is valuable, but also where we're successful with bids. Why do we do what we do? Because we do believe that we need to continuously talk about inclusion, and to ensure that inclusion equates to equality and equity in accessing services, and also that the services that are provided are equal for all. And that's why we do what we do. In regards to, I was asked to speak about also funding, and I think I want to concentrate on the funding that we've had recently through Leeds Community Foundation, which was the infrastructure grant. The infrastructure grant totally was, I don't know, it was invaluable in the fact that it was so flexible. It meant that small to medium-sized charities, organisations actually had an opportunity to place money where it was best needed. Now, we all understand that we need to be accountable for the funds that we get, but to be able to say, okay, we're going to use this money for core funding rather than project funding was, for me, a first. And I know for many of the organisations that we come across as BHI, that was like a lifeline, especially during the pandemic. So, you know, hopefully we'll be able to see more of the infrastructure grant or the resilient grants, because they do help the smaller to medium-sized third sector organisations to continue, especially in a time when the funding has been cut for, you know, the priorities have been about the pandemic, which is fair enough. But if you lose many of the small organisations that have the trust and they're embedded in the communities within the region, then we actually lose an invaluable asset in the third sector. So well done for those who have supported, those who have donated, and for those who have distributed the infrastructure grant. I'm going to move on now to the mental health issue that we have. And I say we, talking from diverse communities. Fantastic that we have mainstream support, but within the diverse communities, and I'm going to concentrate on the Black and Brown communities, there are cultural taboos and there's cultural myths that will stop people accessing. And although there's plenty of wonderful support out there, we find that those from those communities actually don't access until they're at a point of crisis. And that's when they're more vulnerable to being sectioned and being detained and being at the extreme end of the mental health provisions that are out there. Stevie mentioned about men and their, the pressures of having to man up. When we look at the Black communities, say, and look at I would say there's been two pandemics. There's been the COVID pandemic, and then there's been the Black Lives Matter issue, which is where we, unfortunately, some of us saw the murder of George Floyd. I like to take positives out of things, and people say, how can you take a positive out of that? What that did was highlight issues that certain communities are going through. But also that was an impact on a lot of Black people. And what it did do was gave us an opportunity to talk about the microaggression, the exclusions, the oppressions, etc., that many have to deal with that impacts negatively on their mental health. But what stops them from actually accessing the services that are out there are cultural. You know, we are told that that there's nothing wrong with you because it's not been seen. You know, if it's a broken arm, you can see it. Mental health, you cannot necessarily see unless it's being shown during a time of crisis. We also have faith that sometimes can be a barrier because it's they may hold beliefs that say that could actually make your mental health worse. And also faith where when you're presenting for counselling or for any other mental health provision could actually be a barrier, i.e. I know within certain evangelical churches that people talk in tongues. And we've had people come to us and say they've had to explain about talking in tongues to the counsellor, explain their culture before they could even access the services because the culture is not known. BHI has been fortunate in securing funding to actually break or work with people to break down those barriers. We work with faith leaders, we work within places of worship. We actually work as well with the younger community who right now are coming to us and saying the pandemic is having a negative effect on them. It's having a negative effect on many people. But when that's compounded with other issues, then you do have a ticking, and excuse the term, ticking time bomb. And what our fear is that we're going to be having many people, and again, Stevie was right, young men who are experiencing mental ill health but don't feel they're allowed to discuss it, have nowhere to go with it, actually coming to a point of crisis. So what BHI has been doing, again, fortunate to have received some funding, is to engage with those young people in a way that they will want to engage without having the stigma attached to them in regards to not coping emotionally or mentally, and that's through music. We're able to do that because of the arts and culture provision we have. But what we're doing is supporting people to put down in writing how they're feeling, use lyrics to express themselves, and then engage them through the program so that they're speaking out loudly about what they're going through instead of internalizing it. And we're finding that actually helps. So mental health provisions can come in a number of ways. and they do, without actually conforming to the stigma and the myths and the cultural barriers that many people carry with them. We're finding and seeing, and through our research, that suicides are going up within the Black community, and also, more importantly for us right now, young men from Black and Brown communities. So, for instance, there was on the news recently, suicide of a young firefighter who was being bullied in work but didn't think he could speak to anybody, for it wasn't manly to actually go and access any service, and didn't think his employers would listen to him. That's unfortunate. A young footballer who had excellent forecast in regards to his career, but was dropped unexpectedly because another footballer had been identified as actually better than him. He didn't take that very well, didn't speak to his parents, who were born again Christians. He didn't speak to his friends because they were not cruelly on purpose, but saying, you know, you've got to find something else, you weren't that good. And took it on himself, and his mental health deteriorated to the point where he actually committed suicide himself as well. So what we do have to do is be mindful of the divisions that we have and the reasons why some people will not access services, and make sure that all services are accessible for everybody. But also, if we need specialisms, which we do sometimes need specialisms within specialisms, is to ensure that we have provisions that will address these cultural issues, and make sure, if anything, make them open door ready, as one of a better term, to access the mainstream services. So almost like a first stage. And it's about, I think Claudia and is it Laura had said about young men. It's about engaging them before they then take on the mental ill health issues that can compound the beliefs that the young boys are supposed to act a certain way. As a mother of a now adult young man, I do know that's difficult to do, but if we keep on talking, if we're mindful and watching our young ones, and if we give diversionary programs that in itself has a supportive role within it, then I'm sure with mentality and BHI's counselling and other counselling services that we have out there, we are beginning to chip away at the stigma that many hold when it comes on to mental and emotional ill health. And I think I've stayed in time. Have I stayed in time, Kate?
You're spot on. Absolutely brilliant. Thank you so much.